Give me faith, just like you do. God, I look to you. You're where my help comes from. Give me wisdom. You know just what to do. I love you, Lord, my strength. I love you, Lord, my shield. And I love you, Lord, my rock. For you are my place. I will working. You never stop working. You never stop. You never stop. Sing it out. Even when I don't see it, you're working. Even when I don't feel it, working. You never stop. You never stop working. You never stop. You never stop working. Praise the one who set free. Death has lost its grip on me. You have broken every chain. There's salvation in your name, Jesus Christ, my living one who set me has lost its grip on me. You have broken every chain. There's salvation in your name, Jesus Christ, my living Jesus Christ, my living
Okay. Well, hello, Birmingham Bible Church worldwide, and afternoon or good morning, whatever time zone you are watching us in. As always, we like to thank you for joining us here on today. You could have been doing anything, but you have decided to log in and to give us time. And for that, we are so grateful and so appreciative. That's right. This is our Wednesday. So this where we have interviews, we have meaningful conversation, we have in your face type presentations with people from their area of expertise. And so it's always an honor and always a privilege to be here in this virtual space with all of our Facebook followers, our YouTube followers. If you are following us on Twitter, if you are watching through the My Sunday app or through our website, which is bhambc.org, we like to say thank you. I have another great topic here on today from another great guest. She is no stranger, and I'm excited because, all this month we have been having just some great speakers, really try to get our little peeps, our children, our students back in the mindset of going back to school. But these topics are for everyone. So we try to make all of our topics just really something that everybody can relate to. And so we had Tammy, she started us off talking about anxiety. We talked about handling conflict. I can't say about that because Birmingham is just so just senseless shootings. Because sometimes people can't handle conflict. But staying healthy, that was another great topic. And so we want to give you all a lot of things just to think about to help prepare you for school and also in this life. And so another thing that we need to work on with our children being in school is getting our eyes checked. We all need to get our eyes checked, and we all need to know how to maintain the health of our eyes. And so we have an optometrist here on today. She's going to give us some vital information. Her name is Dr. Alexia Vaughn. She is with Advanced Eye Care. And last time I had her on, I don't remember her being an assistant professor. So I'm going to let her introduce herself and tell us a little bit about herself, her credentials, what she does on a daily, weekly basis. And so, hello, Dr. Vaughn.
Hi, how are you doing?
I'm doing great. How are you?
I'm good. I'm good.
Good, good. Thank you for being here with us.
Oh, well, thank you for the invite again for this year.
Yeah, you did such a great job. We just thought we'd just do it again.
Well,
But I know you got some good information for us, but thank you.
oh, yes, you're welcome. You're welcome.
Yes, ma'am. So tell us about yourself.
Oh, okay. So, like you already said, I am an optometrist. The name of my practice is Advanced Eye Care. It's been in business since the 90s. I'm the second doctor owner here. Um, so really what we try to focus on is more eye health and how can we maintain eye health in order to have a lifelong vision, because we always want to see for lifelong. I went to UAB undergrad and for optometry school. And okay, so like you said too, I am assistant clinical professor there also. But I was last year too. I may not have mentioned it though. Yeah, but I've been out for 17 years and I've been teaching for 9.
Wow, wow, awesome. Well, you have a great experience, both in the classroom. I mean, I'm sure you have a lot to just tell your students, and then you have on the hand practice, so you're able to give just a whole conglomerate of it. So I'm excited about the discussion today.
Okay. Hopefully people will get something that you can, of course, take with you and apply,
Yeah.
because that's going to be crucial. Just because we have the information, we always want to apply the information and not put off for another day, because that day will keep putting off and putting off.
Yes, I remember last year, one of my takeaways was really wearing glasses, sunshades outside.
So
And I said,
yes.
that's something I never thought about. And I think I bought our boys a couple of cheap pairs, and I don't know where they are, but anyway, we gotta reapply.
Yes, maybe they'll find them.
All right.
Okay, yes. So today we're going to talk about maintaining eye health here. You were just talking about everything that you all have been learning about back to school. So that is really, really good. Of
Yes.
course, we always want to but I see children too. But one thing that is really, really important for children is to get the eye exam early. We don't want to wait until there is a problem, because a lot of times we've waited too late. So we always have to remember that a child, you have to start out seeing so the brain knows what clear is. If the brain never sees clear, and then clear vision never develops. Okay, so we want to make sure getting those eye exams 6 months. So the timeline is 6 months. And then usually if there are no problems, then it'll be 3 years and then right before school. So I just wanted to throw that in there since you were talking about back to school. So the title of this is The Eyes Say It All. Basically, we already talked about this, introduced myself. Um, so the purpose of our talk today, of course, is because eye problems can cause blindness, and systemic problems affect the eyes. So a lot of people don't realize that if there's a problem going on systemically, and then that will affect the eyes. Our everyday lifestyle, it affects what's going on, what we're eating, our nutrition, the computer world, the cosmetic world. It's all affecting, our eyes here. So I just want to go through some main, like our top things that I see every day. And I'm really starting to see these things earlier and earlier. When we're talking about diabetes, we all know the incidence of diabetes is increasing. We don't exercise like we should. We don't eat the things that we should. Our foods are ultra processed. So diabetes is really being diagnosed at earlier and earlier ages. So I have seen children who've been diagnosed with type 2 diabetes. And so now they're being referred to me, to check to make sure there are no problems as it relates to diabetes. So, just a review, diabetes is basically an increase in blood sugar. So this increase in blood sugar causes damage to the small blood vessels that's in the body. So that would really affect the small blood vessels that's in the eyes and the small blood vessels that's in the kidneys. And these are early changes, but okay. So just when you're diagnosed with diabetes does not mean that the problem is just starting then. The problem was already brewing and the problem was already starting. Okay. So even before we have that diagnosis of diabetes, a lot of times I may see diabetic eye disease in someone who has not been diagnosed with diabetes. So now we got to go, talk to the primary care physician and say, hey, I suspect this person may have diabetes. We need some blood work. Okay. So in this picture here, what we're seeing here is we're seeing some hemorrhages, places where the blood vessels leaking blood. We see the yellow part here. These are called exudates. They also leak out of the blood vessels too. So this is what happens with diabetes. Now, a lot of times people will not know that this bleeding is happening inside the eyes because it doesn't hurt. Sometimes you have vision changes, sometimes you don't. But this is why we always stress, especially for those with diabetes, to have a yearly eye exam. Yearly eye exams are crucial. And of course, we send the records, we send a report back to the primary care physician because the primary care physician wants to know, how are the eyes doing? Is this treatment working? Are we where we need to be? Okay, so if the bleeding gets to be so bad in the back of the eye, the next step after the step to controlling this is to control the blood sugar. So we may need to talk about, blood sugar control, diet, exercise. That is really, really key because we don't want it to get so bad that now I'm having to send someone to the retinal surgeon. Once we go to the retinal surgeon and they started doing laser or they are doing injections, inside the eye to try to stop the bleeding, that may help, it may not help. We don't want to get to this point. Okay. So diabetes is a huge topic that I see. Another huge topic that I see is high blood pressure. So high blood pressure also affects the eyes. There are blood vessels in the eyes. High blood pressure affects it. And I have over here like some questions. What is normal blood pressure? So if you take your blood pressure, you need to know what to compare it to. So our normal blood pressure, we want it to be below 120/80. Okay. So you may be if you're a little higher, your doctor may not start you on blood pressure medication, if you're a little higher, but your doctor may advise, hey, we really got to get on that exercising, eating fruits and vegetables, that type of thing. And how do you know if your blood pressure is controlled? So you don't know unless you measure it. I see patients every day. And of course, I always ask, is your blood pressure controlled? And then the patient will say, yes, it's controlled. What was it the last time you take it? Oh, I don't take it. Okay. But how do we know if it's controlled or not if we don't know what the numbers are? So yes, even if you've been diagnosed, you want to take your blood pressure every day at the same time every day. Even if you have not been diagnosed, but you feel like you're at high risk, you can get a blood pressure cuff from anywhere. Walmart, the drugstore, Amazon, they make really good cuffs now. So, you can keep a check on your blood pressure. Because what you don't want to sneak up on you is what's in this picture too. So just like diabetes had some of these little hemorrhages back there also, with high blood pressure, we also can have hemorrhages in the back of the eye. These vessels back here, if you can see that they have become very narrow. So when the blood vessels become very narrow, and then it's hard for blood to get through these blood vessels. Also, this says AV nicking here. So these arteries, basically it's cutting off the blood supply of some of the veins. So that's what's causing the bleeding, okay? So what this puts somebody at risk, it puts you at risk for having what people, you may hear people say, I had an eye stroke. Okay. So what happened was some of these blood vessels in the back of the eye, the blood flow got cut off and basically caused a stroke. Okay. So that's what we don't want to happen, because if that happens, and then a lot of times you can lose vision. If the same process happens in the brain, then that's what's known as, what people know as a stroke. If something like that happens on the heart, then that's a heart attack. So when we're evaluating these blood vessels, it's given me a glimpse of what's going on in all parts of the body. The other big one is high cholesterol. So with these blood vessels, we can get, I can do photos inside the eyes, and I can see if there are cholesterol plaques that's traveling in the bloodstream. So that's what this is here, like this little Y. We have like a little cholesterol that's stuck in this blood vessel. So past the blood vessel, it's become white because there's not enough blood that's getting through it. Now, sometimes it will completely cut it off, and these blood vessels will be absolutely white. No blood is getting through it at all. But this one still has a little blood flow, which means oxygen is getting through it. So that it's really the same thing as with high blood pressure. It's the diet, it's exercise. If you've been put on medication, people will say, well, I don't want to take the medication. Well, we don't want this circulating, because this can cut off your blood supply inside the eye, like what we call, that's the eye stroke. Okay. If this cuts off in the brain, if this blood vessel is in the brain, that's a stroke. Okay. If this is in the blood vessel of your heart, and then that's a heart attack. Okay. So that's what we're looking for when I'm looking at the blood vessels that's inside the eye. That's why it's important to be dilated. Okay. So one thing that a lot of people may not have heard of, it's a condition that's called intracranial idiopathic hypertension. So everything that we're talking about, lifestyle effects. Lifestyle is important. So I really can't stress that enough. And we will talk about that a little in a few later slides. But what happens here is sometimes, and this happens more in kind of younger people. I say younger, kind of teens, maybe to 50. What happens here is the optic disc swells, and the reason really is unknown, but the cure is to lose weight. That's kind of what's crazy. I'm going to go back here. So if you look at this optic disc, it looks like a nice circle there. Okay. We're going to compare it to this one. So this one looks like this because it's swollen. So it kind of, if I'm looking at it in 3D, it looks like a mountain. And then it's kind of sloping with these blood vessels. So this indicates we have a brain problem. Okay. Because this is the optic nerve. The optic nerve is directly comes off of the brain. So if there's a brain problem, then it causes this. This mechanism is really unknown, but we know that it happens when a lot of times we're carrying a few more pounds than we should. So sometimes it may be, and it could be like 30 or 40 pounds. So I may not see it in somebody who's, say, morbidly obese, but somebody who may say, oh yeah, I gained 25 pounds, I gained 30 pounds. And then for whatever reason, the optic nerve swells. This person may have headaches. This person may hear ringing in the ears. So sometimes there are other things that go along with this, but what we have to do is we just got to get the weight off before we start damaging the optic nerve. Okay. This is affecting us all. It's affecting us right now because we're on the computer. Computer vision syndrome. It's nutritional. Everything is nutritional, but this is also lifestyle. We just don't want to stare at our computer all day, every day. We have to do the computer for school. We got to do it for work. We do it for entertainment. It's the way of life. We can't throw it away. but we just want to take breaks from it. So may have to set a timer every 20 minutes, look up from the computer, look out a window, look somewhere far away for at least 20 seconds and give your eyes a break. So that's called the 20/20 rule. People talk a lot about, do you need blue filters on your glasses? Blue filters help too. What helps a lot is the nutrition. So your eye is built to combat, ultraviolet rays. But it can only do that if you have enough nutrition, like the antioxidants, the vitamins, the minerals. That's what helps your cells clear up damaged cells. So computer vision syndrome, especially school is starting back, has started, for a lot of people. We got to keep those eyes healthy. So what's the solution to everything? Y'all, we hear this all the time. I know. We're all tired of hearing it. Your doctor tells it to you every time you go. Eating a proper diet. However, what I have found and what patients don't talk to their primary care physicians about, but they will talk to me about, is many times people don't know what a proper diet looks like. So they'll say, oh, I think I need to do keto. Oh, I think I need to do Atkins. Do you think I need to do Weight Watchers? Do you think I need to? Okay, they have places, but if you just do, we have to have at least 5 servings. We want fresh fruits. We want fresh vegetables, not really things, that's canned, because the nutrition helps protect our eyes from all of the diseases that we saw. And it helps protect our eyes from blue light exposure. Water is crucial. We hear this a lot. We got to drink the water, and decrease our intake of processed foods. Our increase of processed foods puts us at a very, very higher risk of diabetes. When foods are processed and you have those ultra high carbohydrates, the sugars, a lot of times it's hard for our bodies to process that. So if you just stick to, we call it eating from the ground and eating the rainbow. Eating close to the ground means you want to eat foods in its natural form. So like she has an apple here. We just want to eat the apple, but we don't want to eat like an apple flavored fruit roll up. Okay. Kind of not the same here. That's like a processed apple. Eating the rainbow, we also want to eat a lot of different colors. So we just don't want to eat the same foods all the time. Like we just don't want to eat collard greens every week. Yes, they're good, but we got to mix it up here. We need some reds. We need oranges, red bell pepper, orange bell peppers, radishes. Just a lot of a variety of fruits and vegetables. So also our solutions. Exercise is key. I know your doctor is telling you, have you been exercising? And a lot of times like, well, maybe sometimes I'm trying. I joined the gym, but exercise is crucial. It's crucial. Remember those blood vessels back there, they're small. Your heart has to push blood to those blood vessels also. And if your heart isn't strong enough for that, it's not going to be able to do it. With diabetes, exercise helps control the blood sugar, because when you're exercising, you're burning up that blood sugar. Let's talk about, see, if it's high blood pressure. Exercising will help keep your blood pressure more regulated. So yes, we have pills, we have medications, but we have to do that in addition to exercising, in addition to eating right. So how much exercise should you do? The recommendation is at least 150 minutes a week. So if that's 5 days a week, that's only 30 minutes a day. And it could even just be walking. We don't have to go out and start doing cross training, CrossFit, all this other type of stuff. It could just really, a brisk walk, a nice pace walk would really make a huge difference. So like we said before, your health is everything. Okay. So our motto at Advanced Eye Care is a healthy focus inside and out. In order to see through your stylish frames, your eyes have to be healthy. Because if you're blind from, say, diabetic retinopathy, it doesn't matter what kind of glasses you have on, you still can't see. Okay, so I am here. I have an associate doctor with me too. I'm in Homewood. If you need to contact us, you can call, text, go to our website. We're on social media. We have an on-site optical boutique. We try to feature independent lines. So if you feel like, hey, I can never find glasses that fit, you can come on over and we can find some for you also. So yes, do you have questions for me?
Oh, this was great, Dr. Vaughn. I have learned something once again. I want to piggyback on it about and I guess I'm a dinosaur. So when I grew up, going to the eye doctor was not a common thing. I went to the pediatrician, and that was it. But then when I got our children, pediatricians started recommending, okay, it's time for them to go to the dentist and go to top time. But this one time that our daughter was squinting, she was watching TV, she was squinting. And tell us again, at what age should we start taking our children to the optometrist?
Okay, yes. 6 months is a great age.
Wow.
Even though we know children can't tell you which one's better, but we have ways that we can measure the vision. So what I want to make sure of, I want to make sure of three things. I want to make sure that the prescription is not so high that the infant can't see. Because if you can't see, your brain will not develop that pathway. We want to make sure the prescriptions are equal between eyes. So if one eye can't see, then one eye can. The eye that can't see won't develop. Okay, that brain pathway won't develop. And so that person will never be able to see. Okay. We also want to make sure, there's not a lazy eye. We want to make sure that the eyes are aligned. And we also want to make sure that everything looks good inside the eyes. Yeah. So those are the basic things that we're looking for a 6-month-old. Now we want to do it as early as possible, but we have a little window. We have a little window where those brain pathways are forming. So we have to get it done before the age of 7.
Yeah. And you're right, because when you were saying children are diagnosed with diabetes at the age of 2, I did not know that. And so that's why it's so important to make sure we get them in at months of age, and to school age, of course. I think every 3 years if you don't find anything wrong. Is that right?
Yeah, so we'll do 6 months, and then
Okay.
we'll do 3 years old.
Okay.
And then after that, it may be 1 or 2 years, as long as everything is good.
Okay.
Yeah. But a good rule that a lot of people do, they just do it every year, because I can't keep up with 2 years. I mean, like, just let me go every year.
Same here. Same here. We just schedule outstanding appointment just every year at the so yes, it just makes sense. So you're right about that. Let me ask you, how important is it to know your family history when it comes to certain things that family members have? And I say that because I remember, and I use myself for example. I was to the optometrist, and she noticed something funny, and she said, well, we're going to keep an eye on glaucoma. And I said, well, my mom, she said, years old, she was diagnosed with it. And she said, well, go ahead and do the test. So I say that, and I ask just to see if someone in our family has whatever history of glaucoma or cataracts, whatever, should we go in even more often, or is there something that we need to be doing?
Oh, okay. That is a great example, because genetics will put you at a higher risk. So say for instance, if it is glaucoma, so if we see something that say, this looks a little suspicious,
Mhm.
if you tell me, oh, nobody in my family has glaucoma, then I decrease your risk factor.
Mhm.
If you tell me one of your parents had it, your risk factor goes up. If you tell me, okay, one of my siblings has been diagnosed, then your risk factor is even higher. But yes, it kind of it's really individual in what we find on how often we would see the person. Okay, if it's kind of low risk, everything is looking good. We ran all of the tests, and then it still may be a year. Some people, if they're in a higher category, it may be six months. Some other people, it may be sooner, but it kind of depends on what the diagnosis is and exactly what we're looking for.
Yeah, yeah.
Yeah.
Awesome. Thank you.
Yeah.
Thank you.
So
Yeah.
I need to follow up too, because, okay, so knowing your family history is very important. And a lot of times we don't. Yeah.
No.
Yeah. So people may say, oh, grandma so and so, she went blind, but I need to know, well, why did she go blind?
Why? Exactly.
Yes.
Exactly. Yeah, no, that's a good point. Yeah, and of course, and I talked about this a little bit before, with it and it's just hotter now. I don't know if the sun rays are hotter. You mentioned how even if you have, perfect eyesight. Talk about how important it is to wear shades out and just remind our audience of that.
Yes, yes. It is hotter because we got the whole thing of climate change, global warming, but we
Yes.
also know that more of the harmful rays are reaching us than it was before. So these harmful rays causes in the eyes, it causes, say, cataracts to develop faster. It causes growth, like different growths on our eyes. We all know that
Mhm.
UV light causes cancer, and you can get cancer on your eyelids, around your eye. And when you get it like somewhere here, if it's invasive, like they're gonna have to take all of this away. So UV sunglasses with UV protection, it's very, very important. Oh, I'm sorry. I was muted, but we were just talking about dry eyes here. We can do different treatments for the glands in order to help with the dryness. Of course, nutrition helps also. So, with nutrition, omega 3s are really, really key. Omega 3s help with inflammation. If you can increase fish, walnuts, avocados, that helps a lot with the dryness also.
Good. Awesome. Well, this was wonderful, Dr. Alexia. I really appreciate this information, even the illnesses that you talked about, how those are indicators that we need to come in sooner. So thank you for your valuable information. Listen, just to let you all know, I'm just going to give you a couple of announcements. Don't forget our small groups that meet every Saturday. If you want to be a part of that, it is virtual. Please log in, or sorry, excuse me, send us an email at smallgroups@bhambc.org. That is smallgroups@bhambc.org. Of course, tune in next week. We have another great speaker. So her name is Janice Roberson. I'm sorry, Janice. I know her as Roberson, but it's Janice Anderson. She's going to talk about survival. You have survived. So now what? She's going to give us some great tips and great encouragement on that. Of course, we will see you every Sunday. We are virtual. And then don't forget, of course, we're in person every first and third. But we will see you guys. Of course, Pastor's doing a wonderful series on the master's class on prayer. So we will see you every Sunday for that. Don't forget, he's also on oneplace.com. So you can also get some great teachings, some great Bible studies there on oneplace.com. And just do a search for his name. And we'll see you on the prayer room call, which is every Monday, Wednesday, and Friday. That number is 727-731-0433. So thank you so much for joining us. Alexis, just tell us, I'm sorry, Alexia. I know so many Alexises, but please tell us how we can reach your office again so they can set up an appointment.
Oh, okay, yes. You can call and text the same number. It's 205-942-7740. That's usually going to be the quickest and best way.
Awesome. Sounds great. Thank you so much, Dr. Vaughn. You have a great rest of your day, and thank you so much for joining us. So family, make sure you reach out to Advanced Eye Care and schedule your appointment. All right. Bye-bye. Have a great day.
Bye. Thank you.
Thank you.